in.
Hello there. How are you doing? My name is Mid.
Good, nice to meet you.
Yeah, I'm
Call
a
me
nurse. Very nice to meet you, Donnie. I'm here, I'm a nurse at Chastain Memorial Hospital, and I'm here to do your health history assessment.
Donnie. Fantastic.
So, tell me, what brings you in today?
Well, it's been a while since I've had a checkup, so I thought that I should have a thorough evaluation, and there's nothing super pressing, but I just want to make sure that I shouldn't be following up on something critical. So I'd love to hear how you go about doing an evaluation.
Okay, sounds good to me. Just to inform you, anything you share with me is going to be kept confidential.
Oh, good.
Yes, because we value patients' privacy.
Okay.
So just understand anything I ask, this is just for me to get a clear picture about what's going on, where you're coming from, what are your likes and dislikes, concerns, so that we can address them appropriately.
Fantastic.
Okay, great. First of all, can you tell me your full name?
Yes, it's like the hat, Donald J. Trump.
Okay. I have
No, really, I can prove it with
I
my
haven't
ID.
met Donald Trump
Look,
in life, but you're absolutely right. Your name is Donald Trump. What are the coincidences of that?
who would have guessed?
Yes, nah. How would you like me to call you?
Donnie. Yes.
Donnie?
Yeah.
Okay. All right, Mr. Donnie. So, tell me, when is your birthday?
It's I'm an Aquarian, so February 15,
Okay.
55.
Okay, and that makes you 60. Let's do the
9.
math. 69 years old. Okay, fabulous. Where were you born, Mr. Donnie?
I was born in the home of the Women's Christian Temperance Union, Evanston, Illinois.
Okay, very nice, very nice. What do you identify as a male or a female, or
Oh, well, male.
you're a male?
Yeah.
Okay, fabulous. And what is your race?
Race, well, Scotch-Irish, but I guess according to the forums, probably Caucasian.
Okay, very nice. And are you married, Mr. Donnie?
No, single.
Single, very nice. Any children? Any?
A bunch of nephews, but no kids.
No kids, very nice. And what do you do for a living?
I am a financial consultant, so I've been in the financial world for years.
Mm-hmm.
And right now I'm running my own financial consulting business where I help small business owners who are ready to sell their business and help them raise capital if they want to expand their business instead of selling it.
Very impressive, very impressive.
So,
Does it get stressful?
yeah, it can be stressful in the middle of a deal, yeah,
Okay.
because the owner is, of course, very eager to get money to make something happen or to sell their entire business by a very strict deadline. So yes, it can be.
Okay, very nice. And what is your primary language? Do you speak another language or?
English is,
English?
yeah, the
Okay.
one. I speak a little French too.
We've already touched base on what brings you here today, so it's pretty much just an annual checkup. So you've seen a
Yeah.
primary care physician the past couple of years?
I have, yeah,
You have?
just
Okay.
maybe 6 months ago.
6 months ago, very
Yeah.
nice. So do you have any current diagnosis? Like, do you have any health problems?
I guess a couple chronic things. I mean, I have prostate cancer, but not something that the doctors deem to be critical enough to have surgery or radiation treatment right away. So I'm in what's called an active surveillance program. So
Okay.
every 6 months I get every 3 to 6 months I need to get a PSA, and then I need a biopsy every 2 years.
Okay, and what prompted you to go to the urologist, or was it like annual?
I think it was something that my my doctor was looking at my PSA test, and then I went to a
So they were
urologist.
monitoring it for a while, I'm sorry.
Yeah, and then the urologist did his own diagnostics with the finger trick, and and discovered that I should probably have a biopsy. So,
Not the most comfortable procedure, but,
no.
and do you take any medication for it, or?
I don't. No, really just the periodic testing and the biopsy.
Okay.
And then I also have high cholesterol, so I take
Cholesterol as well?
so I take a statin drug called pravastatin,
Okay.
and
How about high blood pressure, diabetes?
I don't have those,
You don't have those?
fortunately.
Good, good. So you take medication for cholesterol?
Yeah.
No blood pressure?
No, I think my blood pressure is pretty good.
Okay. Do you have any side effects from your medications? Like statins, they tend to cause like muscle aches, anything like that?
I did it first, but then it went away.
You
Fortunately.
adjusted?
Yeah, actually, you're right. I had one medication that was causing me a bunch of pain, and so I insisted that it be switched out, and the doctor came up with a different medication.
Okay, excellent. And have you been hospitalized in the last couple of years or ever?
Just for, I was biking and I had a bike accident and broke my clavicle, my collarbone.
Okay.
So I did have to go to the hospital and be operated on because it was a compound fracture or a fracture involving a lot of bits and pieces that had to be glued together again.
I'm sorry to hear that. Yeah, that's
It was a shock.
yeah.
And so then a metal bracket was put in with a bunch of bolts and screws, and now it seems to have healed very nicely. So I can do sports and have even been on a bike many times. So
Very nice. Which side is it? The
my left shoulder.
Left shoulder.
Yeah.
Okay,
Yeah.
so basically affecting the left shoulder.
Yeah. And then the only other product thing, which doesn't really bother me too much, but I had about at the same time as the bike accident, but slightly before that, I had some vertigo, and then that was diagnosed as vestibular neuritis, which is where there's sort of an argument in science about what causes it, but
It's like a virus that
yeah.
affects the nerves.
Yeah, it could be a cold virus or
Yeah.
it could be chickenpox virus, but it attacks in my case, the nerve from the inner ear to the brain. So my body has to compensate for that to maintain stability.
Homeostasis. Yeah.
Right.
Right.
So I don't take anything for that, although there are medicines that I took initially when I had a really bad case of vertigo when it first came on. But then I went through some physical therapy, and now I think I just managed with it. So.
Okay. But you're comfortable with your current treatment?
Yeah.
Okay, very nice. Besides the fracture of the clavicle, any other incidents or injuries?
No, I think
No.
that's it.
Okay. Going back to your childhood, do you recall any illnesses like chicken pox, measles?
I definitely had chicken pox, so maybe that explains the virus that attacked my vestibular.
It could very much be so.
And I have a few scars in the forehead, for example, from where I scratched my chicken pox. What else did I have? No other illnesses. Just I did break my leg when I was in second grade.
Was it operated on, or?
It was. I'm not sure if they actually cut into the skin to set the bone, but they did. They definitely had to set it. It was a little bit of a difficult fracture.
Okay.
So that happened on a teeter-totter, but that's the only childhood injury that I can remember.
Okay. Any surgeries in the past? besides the clavicle?
Um, no, nothing else.
Okay.
Yeah.
Have you been immunized against like COVID and flu?
Yes, definitely COVID for, everything but the most recent. This year I have not received a COVID
Mhm.
shot yet, just because of some uncertainty about how advisable it is, given all the new information that's come out about the COVID shot. Um, yeah, I'm up to date with other immunizations, and I have traveled not too long ago to Peru and to India and Nepal, where they're very picky about all the immunizations being in
Okay.
place. So
So they
I had a whole
require you
battery of
to get
cholera
vaccinated,
and many things. So
very nice. Are you allergic to anything?
I'm allergic to contrast dyes, and but they tend not to be used too much now. So I think when you have an MRI, they use more sophisticated liquids to kind of get a contrast. So that should be okay with that allergy.
Any food allergies?
No.
No cat allergy?
Yes, I do have a cat allergy.
Okay.
Funny you should bring that up.
People
And
can-
I've tried to take some tablets for that, and it helped a little bit. But
Okay. So,
I still break out in hives and itchiness, wheeziness,
okay.
scratching. So
Yeah, so it looks like you have a full-blown anaphylactic.
yeah, so I can usually tell within about an hour whether a cat has been in the
In the area.
house or in the area, even if they've been put in another room or sent to another house.
Yeah. Well, we definitely won't have cats around you
Okay.
here.
Okay.
How would you describe your current mental state and emotional? How are your moods and?
I think it's good. I've been brought up with that having a balance between mental, physical, social, and religious. So I try and keep all those things basically to give them attention. So I try and get exercise and be sociable and get some spirituality activated somehow
Okay.
every week. Doesn't quite happen every week, but so did I include that all? Mental, physical, mental? Yeah, I think I could use more mental stimulation. So I'm looking at various courses all the time that it would be more of a challenge. So,
Nice. Yeah, it's good to.
but I would say that my emotional state is good.
Okay, very nice. I'm going to just ask you a couple of questions regarding your family history,
Okay.
just to get an idea of, if there's any illnesses in the family that we should look out for. So, can you tell me more about your father and your mother?
Sure. My father lived through his mid to late 80s, and he died of really complications of prostate cancer. So he had his prostate treated with just kind of an earlier form of radiation that they don't use now. And unfortunately, back then, the ramifications of radiation treatment were not good. They would kind of fry a lot of the organs. So I think the result of that treatment really was what did him in. But he had problems with his heart as well, and so he had a number of issues. Yeah, that's a good way to put it.
Yeah.
But he had a pretty long life, and then my mother lived to be 93, and she had some heart and kidney issues that finally did her in. But she had a very active life up until the last year or two of her life. So my grandfather on my father's side died of leukemia, and my grandmother, his wife, lived to 103, so she had a very long, fortunate life. other side, on my mother's side of the family, my grandfather died of a stroke at about 63. He was a very type A personality, and so that probably had something to do with it. And then his wife, my grandmother, lived to be about 99 years old. So in either case, on both sides of the family, the men didn't live quite as long as the women did.
Woman, yeah.
But
How about your siblings? Do you have any siblings?
I have two sisters, and they're both married and have kids, and they're in good health. So
What does good health mean to you?
well, they're able to be active and physical, and seem to be happy in their relationships and with their kids, and so.
Yeah. Can you tell me more about your diet and exercise habits?
Sure. Well, I'm using the C.L. Sutton meal plan, so my diet is something I don't have to think about that much because it's very well balanced and thought out by dietitians.
Yeah.
And not that I always stick to that diet, but I try. And what did you want to know besides my diet?
Exercise. You do like Pilates or yoga.
Oh, okay. So yeah, I try to swim every other day, and either run or lift weights or both on the opposite days, and occasionally do some biking, and so pretty active.
Very nice. Do you use any drugs or alcohol?
Recreational?
Right.
No.
No. Good. Very good. What's
Alcohol, I do, get a drink or two once a week or every other week. Nothing too crazy, usually.
Good. What's your current living situation? Do you live alone?
I live alone,
You live alone.
and no pets so far, but you never know.
Just stay away from cats.
Right.
So do you travel a lot?
I travel intermittently, so for business sometimes I travel, but just usually around Chicago or Illinois. I used to purposely take more clients that were out of state and even out of the country. I had a client in Brazil a couple of years ago, but I found that there are plenty of clients right in the Chicago area, so now I just drive around Chicago to find most of my clients. And the other traveling I do is more for fun, to see friends and relatives. So I go to Canada every other year over the Christmas time to see my sister and her
What
family up
happened
there.
with that smoke that there was a
Oh, that's right. There was a forest fire in Canada that ended up polluting more of the
Polluting the
United
air.
States than Canada. That was awful.
Yeah.
Yeah, that was.
I hope everybody's okay out there.
I think it affected Americans more than Canadians. So yeah, that was horrible. You think of Canada as being so healthy and having such crystal clear air, and normally, at least in Ottawa, the capital, it's not very built up. So you get off the plane and it smells like Switzerland. It's beautiful, crystalline air.
Wow.
Normally,
Yeah.
but
And you don't smoke?
No.
You don't smoke occasionally?
well, I have a cigar every once in a while, but
Okay.
not too many.
Occasionally. Are you spiritual? Do you practice any religion?
Yeah, I go to a formalized church in where I lived for a while and grew up in Kenilworth, and not always on a weekly basis, but somewhat regularly. And that's kind of an Episcopal kind of religion, a type of Protestantism. So yeah, I consider myself spiritual.
Okay, very nice. How would you describe your current health status overall? Do you consider yourself healthy, or
Yeah, I do. I mean, I'm not happy about the prostate thing, but at least I'm doing the
There's a
active,
surveillance,
watchful waiting, I think is another word for
Yeah.
it. Um, so at some point I may have to decide to get some surgery or radiation treatment, the more modern variety that they have now. Or maybe I'll be really lucky and not have to do anything, but we'll have to see.
okay.
They do
We'll
have
cross the bridge
DNA,
when we get there, right?
right? They do have more sophisticated testing now, so that
Yeah.
when you get a biopsy done, they can actually do DNA testing, and sometimes they're able to tell you whether you have a kind of an angry tumor that's gonna be something you really have to have removed right away, or
Mhm.
other times they might be able to tell you that you don't really even have to get a biopsy anymore, but that happens rarely, so.
Yeah. Okay. Any skin conditions, like, do you put your SPF 50 when you go
I
on
have
the
very
sun?
sensitive skin, and that's a good reminder, I need to use my SPF more than I do.
Please do. Yeah.
So, yeah, I have freckles, and
You've never.
sometimes I have rashes that I had a few weeks ago, but I think it was just because of lack of sleep, and so now it's cleared up, so
Okay.
miracle.
Have you actually seen a dermatologist for any of these issues? Like
I do see a dermatologist for some, just to make sure I don't have any dangerous skin
basal cell
lesions.
carcinomas
Yeah,
and stuff,
yeah.
yeah. Okay, very nice. Do you need glasses? Like, when you drive or read?
I haven't, but I just went to the eye doctor last week, and I was kind of right on the border, so the doctor said, do you have a hard time seeing in the dark when you're driving? And I said,
Who
well,
doesn't, right?
yeah, it's a little bit of a challenge. And he said, well, you might want to get a pair of glasses for driving, so now I will be getting some.
Okay.
But otherwise, I have a pair for reading.
Very nice. And you hear well? I mean,
Yeah, I think so.
yeah.
What?
I'm perfect. Way of communicating with you. Any trouble swallowing or like sinuses? Do you sneeze a lot or?
No, nothing that's really dramatic. I think I have, my eyes tend to tear very readily, so that's something I'm trying to get more feedback about what I can do about that from the eye doctor.
Okay. Well, we'll make sure to
I
address
think it's a
that.
genetic thing. I know my mom had the same issue, so.
Okay. You said no trouble swallowing.
No.
Any dental issues?
No, I mean, I have one tooth that cosmetically doesn't look very good. My pirate's tooth, and I'm gonna do Invisalign to kind of make a little room there to have a cap put on it,
Okay.
so.
Okay. But besides that, like cold air, hot air, it doesn't bother
No,
you?
no,
Yeah, no sensitivity to either one?
no.
Okay. Any head injuries?
Oh, that would explain my memory problems. No, I'm just teasing. No. haven't
No
had
head
any
injuries.
Head injuries.
Okay. Any like lymph node tenderness?
No, no.
No? Okay. Do you have any shortness of breath or pain?
No, not really. I mean, just occasionally when I'm swimming a lot of laps in the pool, I don't have as much comfort level, or
Okay, so maybe some dyspnea and exertion.
yeah.
Yeah, okay. Any night sweats?
No.
No, okay. Have you been tested for TB?
I think so. Yeah. I don't know how long ago, but that wasn't an issue.
Okay. COVID? History
Yes.
of COVID?
I've had COVID a couple times.
Okay. And you're vaccinated and?
I am, yes.
Okay. Any swelling to the legs or any part of your body?
No.
No, very nice. Have you ever had an EKG or?
I've taken several stress tests in recent years, so as part of an annual exam.
Okay.
So I have had an EKG that is hooked up to you normally during a stress test, right? And yeah, the stress test went fine. I was able to be on the treadmill for a long period of time, and you know, as it got progressively steeper and steeper, so
Yeah.
so that was fine.
Okay. So no chest pain, palpitations. You don't feel like your heart's irregular or like racing at times or anything like that.
No, I mean, a couple times in the last few years, I felt like it was. I know genetically my mother had an irregular heartbeat, and sometimes I think maybe I inherited some of that. But I brought that up with
The
the
cardiologist.
cardiologist, and he said that I don't seem to have that. So
Okay. Well, that's good. Do you bruise easily?
no,
Um,
no,
Ever diagnosed with anemia or anything like that?
no.
No. Any heartburn, like after eating?
No.
Mhm. How's your appetite?
Very good.
Very good.
Yes.
Okay. No gas, bloating, constipation?
No, not normally.
No, not normally. Do you drink enough water? Do you drink at least 8 cups per day?
Probably not.
Yeah.
Probably much less than that, but I'm trying to ratchet that up a little bit.
Yeah. It's a habit. Just you gotta get into the habit of, drinking water.
Yes.
Yeah. Okay. Any heat or cold intolerances? Weight changes?
Well, I never really like going up to Canada when it's 30 below zero, but other
It's
than
not
that,
like you have to go somewhere warm really fast. It's a matter of like or dislike. It's like
Yes.
you can tolerate it,
Yeah.
right?
Yeah.
Like as long as you're wearing enough clothing.
Yeah.
Okay. Any weight changes?
no, I think I lost about 10 pounds in the last 6 months, and then I gained it back. So I'm on a campaign to try and keep it off, or get it off and keep it off.
Okay. With urination, do you have any urgency, frequency, or dysuria, like difficulty urinating, or?
Yeah, I think I do because of that prostate issue.
You think you do, or do you?
I do.
You do. Okay. I'm sorry. I just have to clarify that.
Okay, that's a good point.
Any joint stiffness, pain, swelling?
No.
No. Okay. You can.
I mean,
when you exercise, it doesn't like bother you, and.
I guess another a small. It wasn't a surgery, but I broke the bone in my hand years ago, and I had to. I think must have a little bit of arthritis in that one finger in my hand because of the broken bone in the hand. So I do have some odd feelings in that finger and that hand because of that.
Okay. Any history of like fainting, weakness, abnormal body sensations, anything like that?
Out of body experiences? All the time.
Let me rephrase that question. Any history of fainting, weakness, abnormal body sensations? Like you just feel like tingling, or burning
No.
in your body?
No.
Okay, very nice. How would you describe your memory?
Didn't you just ask me that before?
I might have.
No, I would say it's pretty good. It's not as good as it used to be, but it's still pretty good.
Okay. Any thoughts of suicide or homicide?
Not in the last 10 minutes or so. No, I'm just teasing. No thoughts of either one.
How's your sleep?
Sleep has been bad over the last 6 months, but then I heard about a great solution of taking some gabapentin. So
Oh, okay, so you're taking gabapentin
I
as
am.
well?
I forgot
Okay.
to mention that. Yes, I am.
It's, and how many milligrams?
100,
Okay,
or well, each pill is 100, so I'm taking 200.
2 pills, so that's 200 at
Yeah.
bedtime?
Yes.
Okay, and that's working for you?
Yeah. Yeah.
Okay, very nice. And obviously this was prescribed by your doctor?
Yes,
Or a
yes.
psychiatrist?
Doctor.
Doctor,
Yeah.
okay, physical doctor, okay.
Mhm.
How do you cope with stress?
I try and use humor, I guess, and exercise.
Mhm,
So running, swimming, lifting weights,
okay,
taking a walk,
Yeah.
getting out in nature.
okay,
That seems to be the healthiest thing.
yeah. And whatever works for you.
Okay.
Do you have any concerns
No, I think
about the
I
future,
mean,
about your health?
probably just, some anxiety about the prostate issue, but, then I think I'm coming up on a biopsy that I have to take, so if that goes smoothly, then, my anxiety will be reduced.
Okay, okay, so it's situational, it's like,
Yes,
it's a reasonable fear.
yeah, hopefully I will not let it take over my psyche between now and when I have to do the biopsy.
What are your expectations from your healthcare provider?
I think to be able to provide good suggestions about treatment, or if I have some new healthcare concern or sort of a worsening of a current condition, then I'd hopefully be able to get some suggestions about treatment options. That's mainly it.
Okay, well, that's enough of information for us for
Okay.
now. I don't think I've missed anything, but if there's anything that you want to add, please feel free.
Okay, no, you've been very thorough. I can't at the moment think of
Yeah.
anything I've left out.
One more thing, since you're alone, you do your own shopping, like grocery shopping and
Yes.
yeah. Okay, so all right. Well, thank you for your time, and I will go ahead and give this to the provider,
Fantastic.
and I'll just have him come in and see you.
Okay, thank you for
Very,
your good analysis. Thank you,
yes,
Midhat.
yes,
Wonderful to meet you.
Meeting you again.